We have an email question from Lori who says, I'm listening to the show on HHT, and your expert is saying that a common symptom is nosebleeds. But what about ulcers or strokes? Would ulcers or stroke history also be indicative?
Well, certainly stroke is a not uncommon problem seen in HHT patients. And I would say in a patient, and I see this at my hospital, a patient with a stroke of unknown etiology, meaning that there's no apparent cause from it, HHT needs to be thought about, and specifically, most of those patients are going to have some type of CT scan or MRI scan of their brain. But if an abnormality isn't seen there, we also have to think about the lungs as being a possibility. One of the problems is it's not infrequent that a physician will order an echocardiogram of the heart looking for a heart defect which can cause stroke. But they may not order the test that which would be sensitive looking for the lung abnormality at the same time. And it really needs to be looked at in those patients where the etiology or the cause for the stroke isn't readily apparent. In terms of ulcer, I'm not sure specifically what ulcer, the type of ulcer the patient is talking about. Stomach ulcer or bleeding in the stomach is a very common symptom in many patients with HHT, unfortunately, and some of them can have bleeding that is severe enough to cause a large amount of blood loss, leading to the need for frequent transfusions.
Okay, thank you. I have a question for you, Dr. Olitsky. So it's autosomal dominant.
Yes.
Is there a rate of spontaneous mutation as well?
It is thought that most cases are not spontaneous mutation. So some family members may feel that because a family member doesn't seem to have symptoms, but if they're genetically tested, many of those patients, they could find the gene defect. So it is thought that spontaneous mutations are very, very rare, and therefore it should be considered that if somebody is diagnosed with HHT, other family members are at risk.
Okay, and you mentioned to one of the callers that genetics or the gene is only discovered in 50% of cases.
The isolated gene at this point is only discovered. We know it's there, but it may not be identifiable in every case.
And that has nothing to do with the symptom presentation, does it?
Yeah, so the nice part about that is the initial screening for that gene by a family member, that result can be used for every other family member to look for presence of the disease. And if you have a very young child, rather than putting them through an MRI scan, which may need general anesthesia, if you could genetically test them, if you know the gene defect, then you may be able to eliminate the need to screen them.
Okay.
You know, as an ophthalmologist, I've made the diagnosis of HHT in probably 8 to 10, 12 patients, just listening to their history, and sometimes it's surprising that it's taken as long as it has for patients to be diagnosed, but that's something that unfortunately happens quite frequently. And that might be the child that I'm seeing for a totally unrelated eye problem, and we talk about something, and it comes up that there's a family history of nosebleeds, and somebody died at an early age due to stroke, and that patient obviously needs to be screened for the presence of HHT.
Right. And I'm thinking that when you mentioned that children who come to the doctor with a history of frequent nosebleeds, almost 100% of the time, in my experience, they're worked up or a bleeding disorder is thought about. I don't think that anyone that I know has ever really thought about HHT.
And that's how we're trying to raise awareness among physicians, among pediatricians, internists, family care doctors, and among ENT physicians. Unfortunately, there's a large number of patients who will have their nose cauterized or even lasered many, many times.
Many times, yes.
The thought of HHT is never brought up with those families.
Right.
And then, a family member has a stroke
and a tragedy happens. Right. Thank you so much, Dr. Olitsky. I am really happy that we talked about this, and I'd love to have you back again.